I'm Nicholas Befera. I'm an interventional radiologist, and I practice at Duke University Medical Center. I'm also the founder and CEO of Scanslated Incorporated. And one of my main focuses in my practice and with the company is patient-centered care in radiology. Healthcare and radiology are moving toward a patient-centered model. So patients these days expect to have access to their medical information, and more than 90% of patients are accessing their health information through online portals. While this is great for patients because it's empowering, it's getting the patient more engaged in their care, which we know improves outcomes, it's also creating some challenges because the information in the health record is really intended for physicians and not necessarily for a patient. So instead of feeling more empowered, patients may become anxious, and so it's having the opposite effect of what was intended. In addition, new federal legislation in the 21st Century Cures Act is mandating that patients have immediate access to their health information. So no longer can there be a delay between when the doctor and the patient have access to the information. And this creates a problem because patients are not only now viewing this information, but they may be reading their results before they've had a chance to talk with a doctor. I'm a radiologist and founded this company with another radiologist when several years ago we recognized that patients were starting to read our reports. So the radiology reports that we were creating for other physicians, the patients were now accessing them, and we started to get some calls in the reading room, patients asking questions about something that they had read online. And so we felt that there was an opportunity here for radiologists and for hospitals to engage the patient and provide something of value, and that's what Scanslated does. So we transform the standard radiology report into a patient-friendly, interactive format. Scanslated is taking a radiology report that's intended for a doctor and making it patient-friendly. So we're transforming it into a report that is specifically designed for a patient audience. The patient experience is straightforward. So the patient accesses the radiology report through the patient portal that they're already using. When they pull up the report, the Scanslated version is presented to them in an interactive web page style format. The report is embedded with plain language explanations and diagrams, which are placed throughout the report in context. So the Scanslated algorithms are analyzing the report, determining what type of report is this and what body part was imaged, and then embedding custom plain language content created by radiologists. All of our content is developed by radiologists specifically for a patient audience. We target a 7th grade reading level, and we provide diagrams to give the patient some context with which to understand the findings. It's important to us at Scanslated that what the patient is reading is accurate and is intended for the radiology context. All of our content is created by board-certified radiologists. We have over 10,000 plain language explanations for terms and phrases that appear in radiology reports, and we also have designed diagrams of relevant anatomy to associate with those definitions. Part of our mission at Scanslated is to make radiology reports available to everyone. And so to do that, we've translated our entire explanation library into Spanish, and we have additional languages coming in the future. Scanslated is using natural language processing and machine learning to transform the standard radiology report into a patient-friendly, interactive format. Our algorithms are analyzing the report text and then embedding custom plain language content throughout the report based on the modality and the anatomy of the exam. So everything's in context for the patient. Patients are telling us they're feeling more confident and prepared to have a follow-up conversation with their doctor after actually understanding their report. We're also using machine learning to extract relevant information from the body of the report so that we can provide additional services to the patient, such as identifying follow-up recommendations and providing content or diagrams that are individualized for that particular patient. What we're providing for hospitals and outpatient imaging centers is a novel patient engagement strategy. This is a way for radiology and imaging providers to differentiate in the marketplace, to give something to the patient that that patient won't see elsewhere, and to provide a top-notch patient experience. Scanslated benefits clinicians by improving the quality of patient interactions, saving time, and allowing the clinician to provide something that patients love. Our focus group patients report that they are more likely to follow up with their doctor after better understanding their report. We save time by decreasing some of the imaging-related calls and messages that doctors are receiving from their patients now, just because the report is completely unintelligible to them. So some of those messages that are imaging related can be answered up front with a product like Scanslated. Scanslated integrates with existing patient portals, so it's easy for hospitals to adopt because patients are still going through the same workflow that they're used to. There's also no additional steps for radiologists or physicians, so Scanslated works in the background, providing the patient something that they see value in without any disruption. Our focus at Scanslated has been a patient-friendly report, and we'll continue to move toward that goal by expanding our content and then incorporating more sophisticated technology to give the patient individualized content. So using AI and machine learning to extract information from the report and provide the patient with a customized diagram or explanation. We're also using machine learning to extract follow-up recommendations such that we can give the patient the ability to initiate or schedule a follow-up exam from within the report interface. Over the next 5 years, I see health tech continuing to empower patients with better and faster access to information and with improved interoperability, so patients have immediate access to their health records and have all the information they need to make informed healthcare decisions.